Hello, and thank you for joining us. I'm Beth Gaddis, the editor-in-chief at Planet DDS. Today, we're talking about how more than tens of thousands of practices have been impacted by the Change Healthcare data breach. I'm joined today by Teresa Duncan, who is known as the dental insurance guru and who provides live and online classes on how to navigate insurance. We're also joined by Paul Kaiser, who is the CEO of DentalXChange, a national insurance clearinghouse that connects providers, payers, and partners. In full transparency, one of those partners is Planet DDS. DentalXChange is integrated with both Denticon and the Cloud9 ortho practice management software, which makes it easy for practices to verify insurance eligibility, submit claims, and reconcile payments. Thank you both for joining us. You guys have been very busy since the news of the Change Healthcare data breach on February 21st. Teresa, let's start with you. Tell us a little bit about you and what are some of the messages in your inbox like right now?
Sure. Yeah. So my company, Odyssey Management, provides live and in-person and online courses on dental insurance. And I also coach a bunch of managers and try to make them better managers. So I'm really hearing it from all sides, my insurance audiences, and then also for my managers. So really what I'm seeing, Beth, in the inbox is a total disruption of their daily behavior. And they are just trying to get answers. And in a situation like this, easy answers just aren't popping up everywhere. So we have to look for them or worse, wait for them. And I think that's what my managers are feeling is I can't wait. I need to get these things out. And so there's just a lot of frustration. Yeah.
Absolutely. Paul, you're on the clearinghouse side of things. Tell us what this has meant for your company. What has the past week been like?
Yeah, it's been crazy to say the least. I would say that the industry certainly wasn't ready for something like this. For our company, and quite transparently, it's been a test of our teams to rally around an industry problem and at scale provide solutions back to numerous dental entities that are super sophisticated, large, and scaled. And I am so proud of the DentalXChange team and what we've been able to accomplish. Our business, I think when we woke up on Monday of February 19th, we probably rough and tough managed, let's say 20% of dental transactions in the United States. When we go to bed this Friday, it'll most likely be over 80.
Wow.
So most of everyone that has been impacted from a dental practice management system perspective has been coming to DentalXChange for help.
That is unbelievable. Paul, when did the security breach happen? I first heard about it on, I think, Thursday, February 23rd. When did you hear about it? Or February 22nd?
Yeah, so the first time that we think that Change Healthcare had publicly said that they're having an issue was, I think it was Wednesday, February 20, what was that?
First?
The first, yeah.
Mm-hmm.
And so, but in working with all of the dental practice management systems that we've been working with on recovery and then getting them back to business operations, we've been asked to message to our payer network that they're submitting claims all the way back to Tuesday because in many cases, they didn't see payer acceptance messages come through normal channels. And so they're worried that it could have even started on Tuesday, but that's not clear. That's, we're pontificating to some extent, but, we're helping them submit claims all the way back to Tuesday of last week.
And Teresa, you were at Chicago Midwinter. Tell us about what that was like.
Wow, it was crazy. Spoke on Saturday at Midwinter, and the number one question that people had, out during breaks and then afterwards was, okay, I'm affected by this. I haven't gone back to the office. What am I going to walk into? I was thinking, well, I don't know, because I'm still finding out too. I mean, I'm walking the floor and finding out just as much. So it is definitely the biggest fear was cash flow. Definitely cash flow. So that's what I think I'm hoping that we can talk about is, what we can do to kind of allay those fears. But yeah, when information kind of comes in at a trickle, it's not fun because you're just kind of waiting and piecing it all together. It's not fun.
Well, why don't you start talking about that? What kind of coaching have you been giving, Teresa, to people that ask you, what do I do right now while the systems are down?
Well, so what I definitely have been hearing yesterday and today is that when they went back and they took a look at their systems, looked at their reports, they thought the claims were going through, to Paul's point, Tuesday, Wednesday, but when they actually read the submission information on the electronic interchange, it was not being sent through. It was still out there waiting. So what I'm asking is to have people make sure that they're taking the 19th and through whenever they get set up with their new exchange, take that period of time and just really watch that. And hopefully it's resolved pretty quickly. People are able to hook up to the next exchange pretty quickly. But the thing is, if they're waiting it out, which I know some offices are, if they're waiting it out, this is a real delay of cash flow unless you are actually dumping it to mail, which I don't love, but right now some people feel like that's their only option.
Paul, jump in. Tell us a little bit about what the transition has been like for trying to get all of these dental practices moved over to, to other resources.
You bet. So, from the get-go, we immediately took the position that if we're going to solve this at scale, we have got to work with the dental practice management system partners. To go one provider office at a time and try to put solutions in place would have been beating our heads against the wall. And so, everyone from CareStream to Henry Schein One to Patterson to Practice Tech to Curve to the likes of Aspen and Pacific Dental. We've had steady conversations with how they're set up and able to redirect claims on behalf of their provider clients in mass and in batch versus one client at a time. And so in large part, the practice management system industry was I'll say mostly ready to do that. And so we have been very successful at working with those different entities and setting up the infrastructure behind the scenes that integrates at scale and in batch, so that instead of having to answer the phone for the first client, try to solve them, go to the next client and try to solve them, we went to the source of the claim, which is the dental practice management system, and solved it there.
Yeah, no, that's smart because, oh my gosh, it's all hands on deck, right? That's what I'm hearing from carriers, clearinghouses everywhere. Like it's 24/7. People are not getting a good night's sleep because they're back at it again, and everything has been paused on other initiatives because this is the true emergency, right now. So there's nothing other than this for most of the offices out there. Can I ask, Paul, how are you doing with electronic attachments? And are people signing up for that through you, or what's your advice to those offices?
Yeah, so the answer somewhat varies. So as you might know, for the longest time in the dental industry, the only attachments vendor was NEA Fast Attach, which is owned by Vine Dental. And we have a great relationship with Vine, and we are successful in situations where somebody's using us for claims management, but then using Vine for attachments. And in those cases, they can just continue to submit through Vine if they're moving over to us for claims. And the integrations that we have with Vine allow that to work and work seamlessly. If you were using Change Healthcare for attachments, then from a business continuity and what I'll just call a disaster recovery perspective, with each one of those practice management system vendors, we've been meticulous about what is the priority, and we have established that the priority is claims. Yeah. And so next is attachments. And so if you happen to be using Change Healthcare for attachments, then we are now working across a multitude of those vendors because a lot of them are live now on claims and we're processing. And so next is let's get the attachments over. And so, and after that, it'll be ERAs. And so we've just kind of gone in order in terms of what we know is important to offices, reestablish connectivity and business operations, and then we're moving on to the next one. So all of those clients that might have been submitting through Change for attachments will most likely be on our attachment solution, because you heard me rattle down those practice management system vendors, and they would be moving to us as well if they weren't using Vine.
I'm curious, have the insurance carriers made any exceptions as far as like what they're requiring for attachments because of the situation? Are they being maybe a little bit more lenient in what they're allowing to come through and get approved, whereas before they might have passed it back saying that we need a different x-ray or we need more documentation in order to review and approve?
I haven't heard that. I
Yeah,
haven't heard that. If anything, they're really their main focus, the carrier's main focus is trying to streamline the EOBs, ERAs, because some were going through Change Healthcare, and now they've got to figure out another way, to reroute that, because there are offices out there that right now that cannot access their EFTs and ERAs, and that's a real problem when it comes to reconciliation. Do you have any insight on that, Paul?
yeah. So yeah, kind of both of those things. I don't have I don't have any data yet that would tell me that they're being more lenient on the need for an attachment. However, I would say, for example, I'll give you a couple of examples. We through our payer networks and our payer teams have been doing constant outreach to all payers to see if we can make exceptions on a variety of different fronts. There's 26 payers in the United States that require enrollment just to submit claims. And so we're asking them to allow for bulk enrollment. And an example of that would be Medi-Cal, or Denticon, some might know them. That's not an inconsequential payer. And in order to be able to submit claims to them, the state of California requires that you have to do an enrollment. Well, you would like to think that in the event of a disaster like this, where an entire industry is shifting to a new claim submission provider, that there could be some exceptions, in a purposeful case like this. And there has been dialogue between DentalXChange and Medi-Cal. They're behind the scenes trying to figure out what can they do to provide a bulk enrollment on the claim side. And then another example would be, in our conversations with payers, Cigna, for example, has decided to allow for bulk enrollment on ERAs. So we'll be working with all of our clients that have been getting ERAs from Cigna, maybe through Change, and we'll be able to pass some files back and forth between us and Cigna to bulk enroll people in ERAs so that we can, not go one at a time. All of these areas, especially ERAs, we're solving the claims bottleneck, the attachments bottleneck. Next will be the ERA bottleneck. But then if you go down the value chain, all of a sudden the bottleneck's going to happen on traditional process where I'm handling so many enrollments for ERAs on a per day basis as a payer. Well, that's going to be a bottleneck. So you better be prepared, for some sort of different strategy in this acute period so that we can solve this on behalf of the industry. You certainly don't want to be the payer who has gotten in the way of a small and medium-sized business owner being able to pay their people and meet payroll, because you wouldn't bend the process. And so we have so far seen willingness to have these conversations, and hopefully that turns into more action like it has, for example, Cigna.
It's funny that cascade that you were mentioning. I mean, it feels like the pain that I'm hearing is that, okay, we thought it was just this, and now, oh, wow, ERAs, oh, wow, attachments. And so it's just become this big onion that just keeps unraveling. And so that's, I think the last part of that is we're going to then in the future start to get a lot of duplicate claims coming back. And that's going to be even frustrating too, because I know that there's offices out there that are hitting them from all sides. They're going through the portal, they're sending it on paper, they're submitting it and hoping the clearinghouse is able to then submit it later. So I feel for the carriers in this regard. There's going to be a lot of duplicate claims out there that are going to come back. And I'm advising, you're going to get asked for additional information, and understand that if you weren't able to submit it the first time, that's okay. We're going to get it there. It's okay. This will be known as the great claims debacle of 24. This is just what it's going to be called, So if you have a timely filing issue, I'm sure you'll be able to point to, look, it was during this time period, and you'll get a little grace, I'm hoping. So yeah, I just don't want people to forget that there was a time when we were able to handle a lot of these transactions. And it feels like we're kind of back in the Stone Age. So I'm not advocating to go back to paper, but it was kind of funny. I read on a forum, what do I do? How do I send my electronic statements if I can't get them? And some of us old timers were like, you can actually print them. So I think people forget that there was a time before electronics, and there are actually people in the office that have never had to print a claim, never had to print a statement. So I just find it fascinating that we've got this kind of convergence right here. Yeah.
So Teresa, let me just ask you, if you could just give us a quick how-to for that person that might have never had to submit anything other than through electronically, and now they're having to find out that new workflow. Can you just give us a real quick, like kind of 1, 2, 3, like what do you do? Do you print out the X-ray? I mean, are you faxing things on over?
No, I'm
tell us through, take us through it.
first I'm going to go to the portal first. So, I mean, if the clearinghouse is saying, look, send them in and we can hold on to them, which I think is what DentalXChange is doing, that's fine. Then send them and let them hold on to it and then just keep checking your reports. But if you need to go to the portal first, if the insurance carrier has a portal, you have login capabilities and you can submit it through there, that's fine. But it's tedious because you got to line by line by line. I remember those days. So that's tedious. And then worst case scenario is the sending it, dropping it to paper. Please don't print out an X-ray. Just wait for the insurance company to request the information. Then you can send an electronic attachment. It's just going to be, it's the Wild West right now. So I'm glad that there's companies that are taking the forefront and getting it fixed. But yeah, I mean, if worst comes to worst, there is something called a stamp in an envelope, which some people will remember.
Yeah, and I want to jump in just because I want it to be clear. We're not holding on to claims. We're submitting it universally across the payer hemisphere.
Okay.
When we in recent, because this was a little bit concerning about how much connectivity do we have, and we've always been very confident in that. When we look at our connectivity, less than we believe in our entire portfolio, including the stuff that's coming to us now, less than 1/3% had any dependency upon Change Healthcare. And as an example, another example, to send claims to United Healthcare, which owns Optum, which owns Change Healthcare, you would think, well, we're probably not able to send to United. We do send to United. United had a clearinghouse, I'll call it a switch, called Nginx, that's still on, and we had always been submitting through Nginx. We're still submitting through Nginx, so we're submitting to United Healthcare every minute of the day. And so by and large, and if that less than 1/3%, we're just dropping a paper. Our system understands automatically whether we have the connection, and if not, we drop it to paper and we send on the provider's behalf.
That's excellent. Paula, are there any other either misconceptions that you've heard or rumors that you'd want to be putting to rest right now?
Wow. I mean, I hate to speculate.
Loaded question.
I hate to speculate on rumors. You mentioned something earlier when we began around people taking sort of the I'm going to wait it out approach. Everyone has, it's their prerogative, their decisions. I've been in healthcare IT for over 20 years. And in fact, my first job in healthcare, I was selling outsourced data center management and hosting services on behalf of Cerner Corporation in Kansas City. I spent 7.5 years doing that. And so I can tell you without any doubt in my mind, an event like this to take as long as it has taken to recover, and with really not a lot of visibility to when recovery might happen, something what I'll just call catastrophic has most likely happened. And I wouldn't bank on the fact that this is going to be something that even comes up tomorrow, much less maybe even this week. And so there hasn't been great messaging out of Change, and at least in the public forum. And so I speculate, pure speculation, that it could be, extensive. I don't know those things for a fact, but it just seems like anytime a company in any industry has a moment of system availability issue, it's not a week, it's hours. And so this seems ominous to me.
Yeah. Well, and the trust that the offices have too, and this has been such a scurry for the practice management softwares that they're all freaking out. I've talked to several, I think freaking out professionally is a good way of putting it, because they're not totally losing their minds, but they've got jobs to do. But I would like to take this opportunity to say to my friends at Change and the ones at Optum that are affected by this, I know quite a few of them over there, that stay strong during all this. And my heart's with you, because this is truly a black swan event right now. I mean, not totally unforeseeable, because cybersecurity is something we're all aware of, but this is truly a rough time for them. So I hope they make it through.
Absolutely. Teresa, how are dental practice operators getting information about what they can do, what they can't do, what they should be doing right now? Who's communicating to them? How are they learning about what they should be doing at the practice level?
Well, I'm trying to get the word out, but not everybody is on Facebook or LinkedIn. I mean, actually, it's good. They're doing their job, right? They're in their offices. So, but unfortunately, we do have a lot of Facebook groups where it's I heard this and I heard that, and they talk to one customer service rep, and it just kind of spreads like wildfire. So, I'm really I'm looking to my friends Andre Chardin at EagleSoft and at the Patterson People. Rick Garofalo has a Facebook group where he's connected to a lot of people. I'm trying to get the word out. And just staying in touch with industry people like yourself that are able to put me in contact with people. I mean, it's look how fast you were able to put this together. Kevin Henry, we were able to put something together pretty quickly. So official channels are always the truth, and that's where I look to. I mean, I'm checking all of the websites and making sure I'm signed up for all the emails. But I would be wary of the conversation in the chat rooms of, well, I heard this and I was told this, and everybody's going to come back up at different times depending on when they get signed up and what they're using. So anecdotally, just saying, hey, I was able to get claims through doesn't mean everybody's able to get claims through.
And you mentioned Kevin Henry. He's with drbicuspid.com.
Dr. Bicuspid. Mm-hmm.
So are there any specific Facebook groups that you recommend, or should people be following you on Facebook under Teresa Duncan? Tell us where people can find information.
My professional is Odyssey Management on Facebook. Rick Garofalo's group is, I think, Dental Billing Academy. He's going to kill me. I should know that. Andre Chardin's group is the EagleSoft Field Guide. And there is a Dentrix users group, but I know Dana Johnson at Navoni stays on top of it. So I'm reaching out to her on a regular basis because she's my go-to Dentrix trainer. And just shout out to all the practice management system people that I've been in touch with. They've been really great. And the exchanges, they've been really great at keeping me up to speed. So as soon as I know something, I'm going to be getting it out. My newsletter should be hitting tomorrow, and my inbox, if I can condense it into a lot of good advice, I will do so. Yeah. So you can find me at odysseymgmt.com. If you've never come across me, you can find me there.
And Paul, what about you? Do you have anything to add about where people should be going to get, real news, real information about what they should be doing, what they should be expecting as far as like how long their particular practice's outage might be lasting and steps that they should be taking?
Yeah, the first place I would encourage people to go is to their dental practice management software partner, whether that's Henry Schein or CareStream or those entities are the best positioned to understand what are they doing in the background with companies like ourselves to solve this and the timing of that. For example, if you're a Henry Schein One client, we've processed your claims. We're no longer in backlog. I think we're all caught up or we're close to it. And so that would be the first place. And then you can always call us. We've now got our support team trained so that once we've identified what system they're on, we kind of have our talk track around here's what you can expect and here's the solution that's coming to bear for your organization and what they need to do. That's where I would go for the information.
And Paul, what words of advice do you have for anybody who's watching right now, who's just not sure? And when you hear that there's a data breach, Teresa actually had talked about this on drbicuspid.com. There is that fear of like, did they access my patient's data? Do you have any words of wisdom about that?
That part, it's going to be what it is. Like my life advice is worry about the things you can control, and whether your patient's data was accessed or not, time will tell, because that stuff will by law have to be disclosed by Change Healthcare. And then, coming back to another question that you asked earlier around ERAs and then ultimately payment and payment and ERA reconciliation. There are other companies that are really stepping up and trying to do significant things in the market. One of those is Zentist. Zentist was here at our offices today offering to commandeer 85% of their workforce into essentially an ERA enrollment task force. And so we're taking them up on that, and we're going to the different practice management system vendors with the idea that the next hurdle around scale and capacity that we're going to need to address is getting all of these clients enrolled in payers so they can start to reconcile. Zentist also happens to have a very cool reconciliation automation platform. For now, we're just focused on ERA enrollments purely. And so there's other entities in the industry that are stepping up and trying to help people get on their feet as well. And so work through the practice management system partner that you have, work through the clearinghouse partner like you have for us, in terms of what's actually happening to resolve the day-to-day problems that you're experiencing, those are the sources of truth.
And Teresa, how about the other side of it? This takes an emotional toll on, practice owners, on operators. People in the practice are already so busy before they had this happen. Talk a little bit about some words of wisdom you might have for anyone who's listening, who's on those front lines and might be really feeling the pinch here and worried about making payroll with everything that's happening.
That is the one thing that I keep hearing. Some of my older doctor clients, not consulting anymore, but the ones that I keep in touch with, they're like, we have enough pad, enough float, but the younger ones that, are still bootstrapping, maybe they're building out or whatever. One in particular, she was almost in tears because she said, I don't know if I have enough. I might have to go get a loan. And I said, well, good news is banks love dentists. You'll be fine. Go get a loan. You'll be fine. So she's going to be okay. But, to my frontliners, this too shall pass. You've been short-staffed before. You've been overwhelmed before. We went through COVID. This will be okay. One day at a time. And if you can't get your claims all taken care of today, they're going to be there tomorrow. So just take a deep breath. It's all right. And, I'd rather you do it correctly than do it incorrectly and really mess something up. So this is, I think, a good wake-up call for all of us to reinvest in technology and make sure that our we're having good cyber hygiene. That's something that I know we didn't even talk about, but I just kind of assumed that we're all going to double down on that. And then also this is good best practices, going back to, hey, what, if things go down, this is what we do. You now have best practices in place for if this happens again, should it ever happen again? Hopefully not.
Good words of wisdom. Paul, how can people get in touch with DentalXChange? What's the easiest way for them to reach out?
Nowadays it's DentalXChange.com and contact us is right there. And there's a variety of pathways for you to get to the right person, depending upon what you're wanting to investigate or talk to us about.
And Teresa, if you could give your website one more time, please.
Sure. OdysseyMGMT.com.
Thank you both for joining us today. We really appreciate it. And for anyone who's watching who would like more information on how Denticon or Cloud9 works with DentalXChange to make the RCM process easier, please visit planetdds.com. Have a good day and thank you for your watching.
Thank you.
Thank you.